it might be worthwhile to just stay on this slide, where there is somebody who's tried to build and relate what kind of nutrition should be had by what kind of oncology patient, given first their culture. Where are you coming from? Are you of this cultural type? Are you of the other cultural type? So the first thing that they've taken into consideration is what is your cultural type, right? The second thing that they've taken input into is what is your medical condition. In this case, of course, the medical condition is some form of cancer, but cancer is of various types. There's no one form of cancer, and even within the form of cancer that you might be talking about, there are various presentations. So what kind of presentation are you actually talking about in the context of that cancer, right? So that's the second thing that is there. The third thing then is your own individual biomarkers, because if you go from cancer to genetics, then again you get a whole set of biomarkers that help you in being able to figure out what kind of treatment is being done. So that's your input data. That's the input stack that you're working with, which is then working through an AI processing engine using deep learning. I leave that. That's not the critical part that we are talking about here. But it is giving you a personalized output. Just like we talk about personalized medicine, it is possible to talk about personalized nutrition, right? And personalized nutrition is easier because it is in the control of the patient, who is ultimately the expert as far as nutrition is concerned. It is the patient or the patient's caregiver, right? So it's in the control of the patient. So the patient has access to personalized nutrition. The ability of the patient to act on that is very, very strong. And that is what makes a tremendous difference. And this is, again, I'll move. Sorry, I'm a Mac guy and I'm getting completely lost here. This is the clinical benefit. So as far as patients were concerned, now one of the things that I don't think it came out, but one of the things that I have found in the medical profession is that unless AI is embedded in a machine, it is not adopted. Whenever AI is embedded in a machine, it will be adopted because the machine won't allow you to work it in any other way. You don't have the option of saying, no, I'm not going to do this. So if there's a radiology machine that says, this is the way it will work, and that has AI embedded in it, then you have to learn that process. But anything which is up to the medical profession, because there is variety, and because there is so much, there's so much kind of resistance, is hardly ever used. So the best thing about this is that it had a B2B2C model, which means that the business that created it partnered with other organizations, which were either in patient support or hospitals, and they then gave it to the customer. So they didn't have the acquisition cost of going around and trying to get millions of customers, most of which is wasted because the number of people for whom it is relevant and who are suffering from oncology is limited. And also it was not left up to the discretion of the patient. And this is a point I want to clarify. This is not becoming Google Baba or ChatGPT. The input into this is actually done by the treating doctor or by the treating clinician. I mean, since this has happened in the US, the doctor is not going to sit around and feed this in, but the treating clinician feeds the data so that the data is correct, and basis that input data, you are able to get a personalized nutrition system. This was done across all the 50 states of the US to take care of the cultural differences and so on. And this is what is the satisfaction level. Now, the one for me which is the most critical is the quality of life, because that's the thing that goes fastest for anybody suffering from oncology. And 82% reported improved quality of life. Now, I don't know how many software guys are here, but hopefully there are some of you here who might be interested in developing certain models like that for India, because this is something that will need to happen in India sometime soon, because the potential is there, but it has to happen in India because our cultural situations are different, our economic situations are different, etc., right? So, but it is possible. You can build it in. There is enough world data. There is enough computing potential for you to build and see, where can you go with this. And I will finally end with the fact that we work with a number of people undergoing cancer recovery today. And what we use today is an engine called Claude.ai, CLAUDE.ai, where I'm giving the specific prompts because it has taken us a month of working with different kind of prompts to arrive at this, to prevent the AI from trying to show off and try to start giving you its own understanding and its own knowledge that it might have, because you don't want it prescribing anything to you. You want to understand whether it can define the problem quickly. This is completely human assisted AI because it is not giving you anything new. What it is doing is it is giving you something fast.